From my experience as a pediatrician working with refugee children, one has to distinguish between two groups of people or patients among these children. One group is the children that come with their families, starting from being babies until older children. Some are being actually born on the journey, or just when the pregnant mothers arrive here. And they have all the health needs and all the health problems that any normal child has. But additionally, of course, they suffer the hardship from the journey. That's the one thing. But also, they have often witnessed violence, bomb blasts, war situations. This is the one thing they're suffering from, but then also they suffer from the conditions in the asylum seekers camp. They're put in at first crowded conditions, unhygienic conditions. Often a problem is also the parentification. What we can often observe is they learn the language much quicker, and they become actually very responsible for the family to interpret on the one hand, and on the other hand they see their parents as not the ones who take decisions, because decisions are taken by the authority. They're being moved around constantly. Their parents can't tell them where they're going, how long they are going to stay. So all these conditions are very difficult for children. It doesn't mean that all children that come here as refugees are traumatized or need psychological care. It's often they need a stabilizing environment. They need to be able to go to school as quickly as possible and to have a routine and standardized structured day as quickly as possible, which is often, unfortunately, not granted. They have the right to get all the immunizations, all the medical checkups foreseen for children, and this is very necessary in order to detect any kind of development problems early. But if this is not organized and not brought to the refugees, how do they know? How do they know that they have the right to get these checkups also for their healthy children, and not only seek health care once they're sick? So this is our job, actually, to bring this health care to the people, and to make sure that the children get all the level of care that that children here have as well. This is the one group. The other group are unaccompanied minors. These are teenagers who make the journey by themselves.